on this computer. All right, welcome everybody to the Virtual Care Partners. Please note, business overview. My name is Jeff Giamalva. I want to welcome everybody that will be logging in from different parts of the United States. And that's because Virtual Care Partners is really out there today looking for people that want to be part of what we really believe is going to be the next big thing in healthcare. Now, understand, we know without a doubt that there's opportunities all around us. And the key to an opportunity is this. Opportunities find problems, and then they have an ability to solve that problem. If you could find a problem and solve the problem, there lies a business opportunity. Now, CARIE Network, CARIE Health has identified a problem. CARIE Health is the company. Virtual Care Partners is the marketing arm for CARIE Health. So what problem did CARIE Health identify? You know what it's called? It was the #1 most talked about issue in the last election, and that's called healthcare. CARIE Health has identified this problem, and the solution to the problem you're about to hear about. And what we're doing right now is we are out there looking for people that have the ability to see something before it happens. And there lies the opportunity. And no better person to really kick off this initial business overview than Dr. Dan McDyer. Dr. Dan McDyer is a board-certified OBGYN. He's our Chief Innovation Officer for CARIE Health. And Dr. Dan McDyer is going to walk you through why we really believe we can really address the healthcare problem. And before I bring up Dr. Dan McDyer, I want to make sure our company is compliant. We want to make sure as we launch this throughout the United States that we dot every I and cross every T. Because we know without a doubt we have something very special here that can help people supplement their income. In fact, most people will not quit their day job. They're going to do this about 4 to 6 hours a week, and let me tell you why they're going to do it. They're going to do it to make an extra $2,000 to $4,000 a month. Then you're going to have a group of people that want to replace their income. And then there's another group of people that we know that can become financially independent when you understand our business model. But having said that, practicality dictates that everyone's results will vary as we are all unique and different. And basically it takes hard work to make a substantial income in this business, and some people will make no money at all. The earnings of a CARIE virtual care consultant will be 100% dependent upon their skills, work effort, leadership capabilities, and market conditions. And common sense would suggest that in most opportunities, one would find exceptional individuals performing well above average, while others perform under the average. Virtual Care Partners does not guarantee any level of income or your success. And of course, this does not account for any business expenses one might incur while building their business. So without further ado, I'm going to let Dr. Dan McDyer share with you the vision of Virtual Care Partners and CARIE product. Now, unfortunately, Dr. Dan McDyer's video is not working tonight, but rest assured, he's a very handsome and powerful man. So, without further ado, Dr. Dan McDyer.
Hey, thanks so much, Jeff. I think it's actually probably better the camera's not working. I got just a few hours of sleep on Friday night and only 3 hours last night, and I've been going ever since. I delivered 4 babies in the past 48 hours, which was a good set of days there. So wow. Anyway, yep, I think I've delivered like 7,000 or 8,000 babies now. It's pretty cool. Got my own city somewhere. But anyway, what the slide that Jeff has up there is the global telemedicine market, and what we're going to review tonight briefly is why this sector of medicine is growing at an exponential rate, and why Virtual Care Partners, along with the marketing of CARIE Health's platform for telehealth, is going to be the reason why that curve takes such an upward migration. What CARIE Health has identified is a multitude of missing pieces in telehealth. In telehealth, it's nothing new. We're doing nothing new in terms of starting a telehealth company, but we're putting together some pieces in our platform that are missing that bridge the gaps that are out there, guys. You've probably heard of telehealth before, but you probably never used it. Only 3.5% of Americans have ever used telehealth. And the reason is there's no awareness. Nobody knows what it is. Even when I tell my patients they can have a virtual visit with me, they have no idea what it is. Actually, the majority of my patients that are offered virtual visits still come to the office to be seen, even though it costs more. Why is that? Well, you know, it's the fear of the unknown. But I will tell you this, the patients that do go successfully through the virtual visit will never go back unless they need to be examined, because they see the accessibility, affordability, and convenience that this presents. So we have made a conscious decision at CARIE Health to use this system with Virtual Care Partners to create that awareness. That's the component of this that you guys will serve in getting the word out about what telemedicine is and why CARIE Health is solving the problems that are out there. The other issues with telehealth is it's kind of expensive for doctors to have in their practices. And the real big problem is that when people successfully use telehealth the way that it's currently formatted, they don't have access to their own doctor. They're actually just seeing a random doctor who they will never see again through the traditional telemedicine companies. With CARIE Health's platform, they will be able to see their own doctor. And that's what 56% of people say they need if they're going to engage in telehealth visits. So CARIE Health is solving that problem with the marketing arm, Virtual Care Partners, which you will be a very, very important component of. For patients, the problem that is solved is it gives them access to their doctors. It makes the care during and even after office hours very affordable and convenient. They demand that. And the cool thing is that the technologies are colliding together with the speed of the internet and the resolution of the cameras on the tablets, smartphones, laptops, desktops, everything to allow this to take place. And from a doctor's perspective, the problems that we have is that a lot of my colleagues don't like doing telemedicine. They all have done it in the past. Most don't do it anymore. And that's just communicating with their patients over the phone. The reason they don't do it is that they don't get paid for it, and they assume liability to engage in those consults with the patients. Excuse me just 1 minute, guys. That could be labor and delivery calling. Yeah, that one can wait. Sorry. I will engage in that phone call shortly. It's the hospital calling. I'm sure everything's fine. They'll call back. I'm not being a cavalier there, guys. I think everything's okay. Also, another thing that the patients or the physicians may not realize, but will soon, is that these other entities out there in the telehealth world and other entities entering the telehealth space now, or I'm sorry, entering the medical space, are creating patient attrition, an enormous amount of that. They are stealing our patients from us because we're not available most of the week to be seeing our patients, and we're not taking telephone calls in general. So the global telehealth market is growing very quickly because of that accessibility and affordability for the patients, despite the lack of awareness and despite the access to their doctors. That's why CARIE Health with Virtual Care Partners is going to cause that huge inflection in the curve. So hit the next slide there for me, Jeff. And I just touched on this. How is telemedicine transforming healthcare? It's creating what everybody wants as a patient. They want access to care that's less expensive after hours. They don't want to go to the ER or to urgent care centers. They just, it's inconvenient. Next slide. There we go. Good. The disappearing doctor. Well, I just kind of touched on that a little bit too. Mega mergers are happening all over the place. The day of the private physician is coming to a close in the very near future. As a matter of fact, I am blessed to be a board member of the largest group of OBGYNs in the country. We're called Florida Women Care. We have 400 OBGYNs in Florida. And my sister groups that are managed by our management company, overall we have 1,200 throughout the United States. In December, I just did a joint venture merger with that company. Why? Because there's power in numbers. And it's the only way for doctors to survive. It's difficult for us to survive out there because reimbursement's declining. And what many of my colleagues don't understand, Hang tight. One, guys. Jeff, can you put me on mute for a second? I got to answer this call.
Go ahead, Dan. I got you. So here's the deal, guys. Everybody has to understand. Doctors are faced with a problem, and here's what they're saying to them: innovate or die. Because the disappearing doctor and mega mergers are changing the business of medical care. Now, here's where you have to understand why we have something special. Every unbelievable opportunity has a visionary. Without a visionary having the ability to see it, okay, we don't have an opportunity. Our visionary is Mr. Matt Wanderer. He is our CEO. Mr. Matt Wanderer was featured, okay, understand this, just last month in the Silicon Review publication. And I want you to pay close attention to the title. With a digital on-demand platform, CARIE Health is reinventing the concierge care experience for all patients across the country. We are getting national recognition, and we have not even launched yet. And you have to now understand the power of what we are sharing with you tonight. So, Dan, are you back?
Yes, that was an emergency stool softener call. Can you believe that?
You guys are really seeing the real deal tonight.
It's unbelievable, man. It's unbelievable. That's the physician's life, though. All right, so why telehealth? Why is it going to grow like that first slide showed? Well, it's because the studies show that most of what patients seek care for after hours and even during hours, when they consider it an acute emergency, is really not an emergency. These issues can be taken care of with virtual consults and virtual care. As the statistics here show you, 70% of all acute care, urgent care, and ER visits can be handled safely and effectively over the phone or video. I can tell you that is 100% true, if not an underestimate. And patients love the telehealth visits when they have them. 91% say they're as good or better as going to the office. My patients, it's 100%. I mean, their eyes get as big as the earth when they have completed that telehealth visit, man. They're just so excited about it. There's also a cost issue. Now, in urgent care centers, there's $155 average deductible that they pay out of pocket to be seen, and that is far, far less than an ER visit. Back in July of last year, I got a really bad case of food poisoning. I got a $3,200 bill from the doctor and the ER. That was what it cost me with my insurance for 1 hour and 15 minutes of care in the ER. And then the wait time, 4 hours average time to be seen in the emergency room or in urgent care centers. And sometimes in the doctor's office, it's not far from that, guys. It's an hour or 2 hours sometimes if you're an emergency add-on patient, if your doctor does that. So it's highly inconvenient. 75% of most practices are closed after 6, so there's no access to the doctor. This is the gap that we bridge with our telehealth platform through CARIE. And the average number of days to see the doctor, 21. And 66% of ER visits are non-emergency. I've worked in the ER before. I can tell you that's 100% true. People are just using the ERs as their primary care doctors. What conditions can be treated with virtual health? Well, the sky's the limit, truthfully. This is just a small list or a sampling of what can be done. I'm discovering new things every day. It's just so exciting to see what we can accomplish with the convenient visits of not having to come to the office. The benefits to the patients, we probably talked about this already ad nauseum. 24/7, 365 availability in 50 states. No leaving home or childcare costs. Quick little example, about 3 weeks ago, I had a patient who was just moaning and groaning about having to put her demographics in to get the app on her phone and then to have to pay the $59 fee to see me virtually. Well, eventually she overcame that grunting and groaning and did it. And we did the virtual consult. And at the end of it, I told her to go ahead and close out her app so I could finish up typing up her visit note. And as she was turning off the app, she looked over at her baby because she couldn't get childcare. That's why she couldn't come to the office that day. She looked at her baby on her hip and said, "That was really cool. I can't wait to do that again." Totally transformed patient, guys. And she was giving my office staff a really hard time about doing it. So totally transformed her. There are no co-pays. There are language lines that can help with the translation. And the most important thing is no travel time to the physician. It's highly inconvenient to come to the office. The telehealth pressures for physicians to consider using this, the patient attrition like we talked about, the payers are stealing your patients because they're partnering with Teladoc and MD Live, the two largest telehealth companies that are out there. Other health systems are out there stealing our patients with partnerships with Minute Clinic, Walgreens, CVS, and then retail pharmacies have their clinics in there, and Walmart's even getting into the healthcare space, guys. It's pretty scary what's happening to the private physicians. For us, that call I just took, I don't get paid for. It's terrible. I mean, I do it because I thought I was supposed to, but in getting involved with this telehealth industry and discussing this with my friends and colleagues more in detail, very few of my colleagues actually take calls after hours. They just don't do it. Why? Because there's no pay and there's liability in it. I got sued over a phone call 18 years ago, and I was involved in that for like 3 or 4 years, finally got dropped from it. But man, it took years off my life. You never know what's going to happen once you step into the vortex of a medical malpractice case. Man, it's crazy. So with the CARIE Health platform that the virtual care partners are marketing, you have the world's most powerful telehealth platform that's coming your way on October 1st. It is truly incredible. I've seen it in action. I'm using the current iteration that precedes this. It has worked absolutely flawlessly in my practice, guys. It's transformational. The new platform will be self-provisioning, taking literally 2 minutes to implement in the practice. It integrates seamlessly into the practice. It can create immediate revenue for the physician, and the physician can share it with their colleagues and earn a physician referral fee for sharing with their colleagues. So it's going to encourage the growth of the platform getting into the hands of doctors. There's actually a freemium model where the doctors can use it for free to give it a trial run or a test drive before they start engaging in the true telehealth visits. And for the practices, we are putting together an incredibly strong turnkey marketing program to let their patients know that this is available and that they can use it. How do the telehealth visits work? It's really cool. I wish we had a better mock-up, which we will in the new presentation we're putting together for you. The telehealth platform's completely branded for my practice. That's what I look like when I've had sleep, I think, right there on that screen, guys. Anyway, my patients get the app through me. They put in their demographics, a credit card, and when they want to visit, they request a visit, and literally within microseconds, I get a text message saying that there's a patient waiting for me in my CARIE virtual waiting room. I simply go to my computer when I'm available. I open up my micro website. I see which patients are waiting. I click on a little camera icon next to their name, and then boom, within 10 to 15 seconds, we're literally face-to-face on the screen after the system checks the internet speed and the connectivity. The consult literally takes 11 minutes on average for me, from start to finish. When I finish writing the note in the computer, in the medical record platform in CARIE Health. And it's like I've said, it's transformational. The patients love it. I love it because I'm getting paid for what I did for free before, and I'm also saving my patients money by not having to come to the office and pay their deductibles. So it's a win-win for everybody. And that is a sample patient, and that's a sample doctor right there on the screen. So that's kind of how the screen mock-up or screen looks as I'm performing the telehealth visit. I have access to the records on the screen. I can prescribe medications through the platform. It can actually identify where the patient is and where pharmacies are close to that patient. So it's really, truly incredible, guys. What I really want to express to you is hopefully my genuine excitement about what's coming our way and what's currently happening for me in my practice with virtual care, and what's going to happen in the future is crazy and incredible. And what I realized as I started getting involved in this opportunity with Matt and the founders of the company and in telehealth in general, but more specifically this platform, is that very few people ever have a chance to truly make a difference that affects so many people in such an important industry. And that happens to be healthcare here. I truly believe if we do this correctly, and we've chosen this marketing plan with intent, because we believe that you and we together can blanket the country with a new version of telehealth that makes it a success for everyone. Everyone wins, and you win by getting the word out there for us. So you can truly, with us, leave a mark. Believe this or not, you can leave a mark on a drastic change in healthcare that makes everything so much better. So with that, Jeff, I'm going to turn it back over to you, man. I hope I covered enough information. I know I ramble on sometimes. I'm sorry about that, especially when I'm super tired, but it's been great having the opportunity to speak with you guys tonight.
Awesome. Thank you so much, Dr. McDyer. And obviously, we just lived your life for a few seconds there of constant calls and delivering babies. But what I want to do, guys, is I want to transfer and really take you to the opportunity that is really going to be presented now to all the people that are on this call. Because I know we have people that I personally invited on this call that are looking for the next big thing. And, you know, people make decisions simply because of information that's given to them. So what I want to share with you is really what the opportunity can provide for you from a financial standpoint. So first of all, my wife and I, Lisa, we're a team. We are the vice presidents of partner success and vice presidents of sales and marketing for this company called Virtual Care Partners. And what we're doing now and what we're looking for is we're looking for leadership. We're looking for leaders all around the country that buy into our vision. And for those people that buy into this vision, we're going to give you an opportunity to own your own business without the traditional overhead. 85% of the people out there, when polled, said, I would love to own my own business, but I don't have the financial wherewithal and I don't have the know-how. At Virtual Care Partners, we take care of that problem. And you will also receive, this is a big one, the same tax advantages of any other business. We also provide people, we understand we live in an instant gratification society. This is how CARIE Health was born. Because people are sick, they want to see a doctor now. Well, the same thing happens in our opportunity. People see an opportunity, they want to make money now. Well, we have an immediate income component that can help you supplement, replace, or help you become financially independent. It's just a matter of what you see. And for some of you, it may just be to cover a car payment. What would an extra $500 to $800 a month mean for the average household? Or a mortgage payment, a child's tuition? I will tell you, we will put people on business plans to make 6 figures their first year for people that want to get more aggressive. And I know without a doubt, we will have 7-figure income earners coming from our platform. Now remember your income disclosure. But how about a group of people out there that are looking for advancement opportunities? How many people out there are stuck? They've hit the glass ceiling. How many people wake up during the night thinking, man, I wish I could be paid what I was worth? How many people on Sunday evening think about firing their boss on Monday morning? Well, we give you in the initial stages a plan B. But our plan B can quickly replace your plan A. And that's when people make a decision to go full time. And one of the things that every wealthy person understands, which is a very big component to our compensation plan, is called residual income. I've never in 25 years met a wealthy person who doesn't understand residual income, because they're making money off their money or their investments or off other people's actions. Our platform at Virtual Care Partners gives you an opportunity to earn what you do today into the future. And if you really want time freedom and money freedom and a secure retirement, let me give you your secret to success. And if you find it here, great. But if you don't find it here, you gotta find it somewhere. And here's the answer. You gotta stop trading time for dollars. Otherwise, you're limited to the number of babies you can deliver. Dan, right? The number of hours you could work. The number of sales you can make. But just imagine the concept of earning a percentage off every OBGYN across the United States who are delivering babies. Where do you make more money? Delivering the babies yourself or getting a percentage off all the other people delivering babies? Well, we're going to give you an opportunity to deliver the babies. Let's just go with that theme tonight, okay? And what we pride ourselves on is our system. See, what you're seeing here right now, even though we are in pre-launch, even though we're a new company, the systems that we're putting into place, there's people that are putting them together with over 100 years of experience. This is not on trial. We're going to offer you personal and group coaching. There's turnkey programs that you could get involved with, a weekly calendar of events that you can leverage, and a social media platform that will allow you to build a business from your home all throughout the United States. So this is the opportunity that's attached to the CARIE Health product. And right now we are in pre-launch. During this pre-launch phase, we're giving you an opportunity to take advantage of getting involved. We call it first movers advantage. Our product, just so you understand, is our certified solution provider license. That's our product. To have access to the product, it's $399, and your entire overhead for your entire company is $99 a month. That's your overhead. That gives you your enterprise license. It gives you the mobile healthcare training certification. It gives you the ability to deploy as many doctor practices as you and your team wants to, a marketing assist program, and a lead generation for top performers. So your cost of doing business is $399 and your overhead is $99 a month. And everything surrounds the ability to sell memberships. For a single person to enjoy the benefits that Dr. Dan McDyer talked about, it's $29 a month. Think about that. For an entire family, up to 5, $49 a month, 24/7 care. They sign up and they could start seeing a doctor. No office hours. If a prescription is needed, a prescription is written and sent to the pharmacy of the patient's choice. Now, think about that. We have some business owners taking advantage of our memberships, and that's the healthcare they're providing for their employees. So understand, it's our ability to sell memberships. So why do you think we're targeting the physicians? Because they control a patient base. And so what I want to show you is I want to show you a couple of business plans. And I hope you really now, if you're multitasking, I urge you, just stop and just pay attention, because you've taken the time on a Sunday night to want this information. I want you to get the concept here. Because I know one thing, I know the power of what one presentation can do for someone's life, okay, when they identify it. Because I remember the first presentation I saw 30 years ago, and it changed the course of my life. So understand, you could go out there, and you could sell memberships. You could deploy doctors, and you could make a really good income doing that. But some people on this call in particular, because I know there's a lot of people on this call now, and I personally invited you that have built huge teams because you want to get a percentage off your team. So let me walk you through this. Let's say you went out there and you decided to get involved with Virtual Care Partners, and you knew at least 40 people that would join you on this venture. Okay, do you understand? Okay, if you brought in 40 people between now and October, I'm just showing you a plan. You could use 20, you could use 10, doesn't make a difference. Okay, but understand, those 40 people start paying $99 a month. So since that is a product, we pay commissions on that. So just by start to bring over your team, you put together a $792 a month residual income, just off people that have made a decision. And let's say those 40 people went out there and found 3 each. You now have 120 virtual care consultants on your second level. And now you're earning $1,188 off that group. And if you took that same geometric growth of everybody after your initial 40 getting 3 people, you put together a team of 4,800. And I know some of you on this call are laughing at that number because you've built teams of hundreds of thousands. 4,800 people, okay, out there on the $99 membership. You put together a residual income just off your team of $13,000 a month. And you've yet to sell a membership, and you've yet to deploy a doctor. Now watch. Now, come October 1st, when we officially launch the CARIE Health product into the market, now you have 4,800 people ready to go out there and sell the memberships and deploy the doctors. So let me explain this slide to you. I'm using my expertise and my knowledge of the industry. And what I do know is not everybody that says yes is going to do something. In fact, the business plan I'm going to show you right now is based on 2/3 of them doing nothing. 4,800 people, 2/3 don't do anything. They just signed up. And you have 1/3 go to work. Well, 1/3 of 4,800 is 1,600 people. Now let's just say, follow me here, they all got 1 doctor to say yes to our free program. 1 doctor to say yes to our free program. Let's say it took them a year to get 1 doctor. End of the year, you have 1,600 doctors in your network. You know each doctor controls a patient base of 2,500 to 4,000. So that means we have 2,500 to 4,000 opportunities to sell the membership. Let's use 2,500. 1,600 times 2,500 is 4 million patients. You got to follow me, because if you get this, it's over. Let's take a 5% conversion rate. 95% of the patients said, no, I don't want the membership. But 5% said yes. We're being very, very, very realistic here. We believe we could have a 30% retention rate, minimally. But 5% means you have 200,000 patients on our membership. This would be your opportunity per month. $152,000 a month. And I know some of you at this point are laughing, but you can't laugh at math. This is just math. Now you could play with the numbers, but I'm just showing you. Because I know without a doubt there's people on this call that have the ability of building a team, and we know as of today, you can have virtual care partners bringing in hundreds of doctors' practices, not just 1. Another example, just another example. I just want to get your brain working here tonight. I have 1 shot to get you to see this. You share CARIE with your doctor. The last slide was 2,500 patients. Let's use 3,000 patients. And that practice converted 10%. Now watch this. You want to do some easy math? 10% of 3,000 is 300 patients, right? On the $49 membership, that's $14,700 a month. You would earn 10% off that. That's $1,470. How many practices can you bring in? What if you just brought in 10 practices yourself? How many people out there make $14,000 a month? Can I tell you? 3% of the people in the United States of America make $100,000 a year or more. With 10 personally enrolled doctor practices at a 10% conversion, you're at over $14,000 a month. And the rest just shows you if you decide to build a team of not bringing in 40. What if you brought in 5? Who brought in 5? Who brought in 5? And you had 155 virtual care partners getting one doctor practice. Well, how's 52,000 a month? If 152 scares you, how about 52? Cut it any way you want. This is going to happen. Now, you may say, well, he's cocky. I'm telling you, I understand. We're going to secure 35,000 practices in 18 months. And those 35,000 practices are going to be underneath our virtual care consultants somewhere. It's a matter of, this is going to be you. So for those people that really want to take this thing to the next level, let me share with you what you would need to do. You get with the person that got you on the call. You get yourself signed up. You see how easy that is. And now you want to start earning immediate income. We're paying our immediate income to the people right now that want to start building their teams before we launch. So you're going to want to maximize your earnings. So here's what happens. You get started. Here's you. You want to bring in 2 people within your first 7 days. These aren't doctors. These are people that want to be part of the opportunity. On your first person, they sign up for $3.99, you make $100. On your second person who signs up for $3.99, you make $100. So 25% immediate income. Once you get your first 2, and if you do it in 7 days, you immediately, on every person you bring on your team thereafter, personally, you make $200 per person. On every $3.99, we're paying you back $200. So we're incentivizing, see, understand where we're at. We're incentivizing building the base of virtual care partners now, because we need an army come October 1st to go out there and deploy the physicians. If you can't do it in 7 days, you need to sponsor 5 people over any length of time to get to your 50% immediate income, where you're making $200 per person. This right now is putting some significant immediate income into the hands of our virtual care partners right away. So, simple steps. Step 1, enroll. Get with the person that got you on the call. They'll send you a link. Get in. And now all you want to do is start marketing to your top 100 contacts. All you want to do is send them the introductory video about CARIE Health's product and the virtual care partner opportunity. For those people that show an interest in this, because there's tons of people out there looking for the next opportunity, all you want to do now is you want to lead them to the information. And that information can come in the form of a live webinar like this. I'll give you the schedule here in a second. It can come in a recorded webinar. This has been recorded. You could send this to your prospect, or it could come in the form of a 3-way call. Bottom line is, in the beginning, you're a professional introducer into the information. That's all we want you to do. Open up your base, let them know, and then lead them to the information. And we do these presentations 3 days a week. On Sunday, it's a business opportunity presentation. We're talking to you about the business. On Tuesday, Dr. Dan McDyer talks the doctor talk to the physicians. A lot of physicians on that call. And on Thursday, we do another business opportunity presentation for the people that want to understand the business side. We don't mix the doctor with our business opportunity presentations unless they want that information. In the beginning, they just want the information on the product, and that's Tuesday night. So, once again, as I close out, take advantage of the pre-launch opportunity, guys. Okay, I've been in this industry a long time, and I understand traditional business. And to get involved for the amount of money it takes to get involved here, is very simple for the average person to say yes to, and then start building a significant residual income for your future. I appreciate you for coming on Sunday night. Dr. McDyer, I know he's probably delivering a baby right now. Okay, I thank you for being on the call, and I look forward to seeing all of you on the call Tuesday night for physicians, and Thursday night I will be back to share with you the opportunity once again. Appreciate you. Thank you very much. Have a great Sunday night.